Ta-da! You've been following me around. He's always following me around. In my face. Hello, how you doing?
Good.
Yeah. All right, so it's our 2-week visit.
Yeah.
And let me peek here at the weight. Oh my goodness.
She's a chunk.
Birth weight was 8 pounds and we are at 9'9".
Yeah.
9'9".
9'9".
9'9".
Oh, I thought she said.
That's like a pound and a half above birth weight. So you guys who are watching, this is a 2-week-old baby. And normally we get back to birth weight at 2 weeks. You know, 10 days to 14 days. We are a pound and a half above birth weight. That's...
It's a magic milk.
Magic milk. There you go, it's magic milk.
It is, it's freaking magic milk.
Breastfed only?
Yeah.
Yeah. How often?
Maybe a little lamb on the side. About like 9 to 11 times a day, and I only know that because I'm doing that app.
Oh, okay. And how long do the feedings take?
It depends. Like sometimes I think she empties a breast in 6 to 8 minutes.
Fast.
But she then just wants to suck.
She goes to the other side after that?
Yeah, she'll go to the other side,
so
but sometimes she's like...
Yeah. You probably have enough in one side for a full feeding.
But she also is like pooping all the time, so I think she's like...
I could predict that.
Eating
with
too
that
much.
kind of... So that kind of weight gain, and you're pooping all the time, then you've got enough for twins.
Yeah.
So you can totally relax. I mean, when you know what you know now, if she sleeps all night, let her sleep.
She won't.
She won't. But,
that's the other thing. She wakes up to eat and then she gets gassy. There's a 2 to 4 in the morning where she gets really...
Is she fussy? Or
she's fussy about it. No, she's fussy about it.
Okay, so...
And that's the only time she's fussy.
Interesting. At 2 to 4 in the morning.
2 to 4 in the morning.
Oh, I'm sorry.
I know. That's what I learned.
It could possibly be a little being overfed.
Okay.
And you're getting, you know...
Yeah.
If you get your intestines, right, so milk's just flowing on through. If it backs up at all or it's just going through a little too fast... If you've ever had a gas pain, it's a sharp pain. It's the same thing as getting distended from too much milk.
Yeah.
So I don't know. It's hard to tell a baby, hey, you've had enough. Yeah. But if things are slowing down, just disconnect. Walk the floor a little bit, not in the middle of the night if you can avoid it. But
no, I tried pacifier.
Yeah.
She is like
won't do it.
Repulsed by it. She's like, what is this plastic nipple?
What?
She's had the real thing.
Yeah. No, well, the pacifiers don't have the sweet milk, and you know, there's not the magic.
Yeah, we're talking about you.
Yeah.
She knows we're talking.
So anyway, you've got that luxury of doing whatever you want with feeding because you've got plenty. So if you're both sleeping, sleep. If you can feed a little less, not that you have to, but you know, if she seems done, let her be done. Okay. Yep. I'm gonna wash my hands and then we'll borrow this little one, take a look. So this is not a surgical hand wash, this is a pediatric hand wash. Perfect.
She's so noisy. She makes so much noise.
Heart and lungs sound good. I'm gonna borrow if I may.
Yes.
All right, here we go, little one. What is happening? What is happening? So the white on the lips, I could imagine people asking about that. I think that's just suction blisters. I mean, you're nursing a lot. Yeah. The way we make sure it's not yeast is we look in the gums. So kind of looking inside the mouth to see if there's white plaques. I'm gonna get a little tongue ring and just enable us to look a little better. She's such a little hair.
I know, she's actually, she turns it on. The camera.
Okay. You've got eyes for mama, that's for sure.
Can you repeat that?
So we've got the white on the lips, but when I move that lip down,
there you go.
You can see the gums are fine, perfectly pink. If this was yeast likes warm, moist places. So you're gonna have white on the gums, not just on the lips. So that's totally fine. That does not look like yeast or thrush, and you can see now in those gums. White on the tongue is fine, so you guys might be able to see some white on the tongue. That's not thrush. But a lot of people get confused about that. So now I'm gonna be just opening your mouth to kind of get you mad. Look at the tongue. There we go. That's a nice tongue. I mean, these days, that's better than most. So, I'm sorry. Okay, I'm gonna check your hips, get you really mad. Now that you're already mad, I'm gonna check pulses. Femoral pulses are, there they are, good. Hips, doot. Hips are good. Nobody likes their hips checked. So I'm gonna clean that up for you. I'll be right back.
I'm sure you.
All right,
you have
so we
tri-
just get
Just
a
with
little,
water?
This is just water on a sterile Q-tip.
Oh, look at that. See,
And
that's
that's
what.
just a lot of old dried blood, which we can get off of there. Get that off of there.
Yeah, Mika. It's not me, it's him.
That's me. Dr. Paul's doing that to you. And then you can do baths now. And then
Oh, yeah.
after the bath, you take a dry Q-tip. And parents
She
tend to
loves
be,
it.
parents tend to be way gentle. You can see it's a little red, so
Yeah.
it's still kind of oozing. So after the bath, you can hold a little bit of pressure.
Yeah.
You can see I'm holding a
I don't
fair
know why
amount of
that. Yeah,
pressure.
yeah. I don't know if I did
doesn't
it.
hurt
No, it
anything.
just bothers me. Just belly button.
I know.
Belly buttons are weird.
Yep. So we're gonna just flip you over and look at the back. Your back looks great. Look for a deep sacral dimple. We're good. Nothing to worry about.
Her head.
All
I
right.
forgot this, Dr. Thomas, but
Yeah?
it felt so divoty. Is that normal?
That's a very sunken soft spot, but it's totally fine.
It is totally
Yeah.
fine.
When we were in training.
Why
we
does
used
it
to-
sink like that?
It's just the way it is.
You guys are horny. Oh my gosh, your feet are cold. Your feet are cold. What are we gonna do? Damn it, I love my little.
New baby feet.
Oh, totally. But see my Layla's little toes underneath, you know, after a while would stink so bad. But it's like your crazy mom. You just love the smell. But yours don't stink because you're perfect. Don't tell him I said that.
Red reflex. Perfect. All right. The whites of the eyes are nice and white. There's no jaundice to worry about. You can see that's about as good as it gets. We have a perfect baby. What a surprise. So you guys, big thumbs up for our most amazing baby ever. And Super Mom, thanks for watching. I'm Dr. Paul.